Cervical cancer is preventable, yet it accounts for 16.5% of all new cases of cancers in women. It is the second most common cause of deaths from cancers. HPV vaccination and screening and treating precancerous lesions can prevent most cervical cancer cases. When diagnosed early and managed effectively, treatment of cervical cancer is highly successful. Yet, there are an estimated 97,000 new cervical cancer cases and 60,000 deaths caused to it in India every year. These cases and deaths can be prevented. The 73rd World Health Assembly adopted the WHO Global Strategy to accelerate the elimination of cervical cancer as a public health problem in 2020. That same year, the strategy was formally launched on the 17th of November, which now marks the Day of Action for Cervical Cancer Elimination. The strategy aims to ensure that by 2030, 90% of girls are fully vaccinated with the HPV vaccine by the age of 15. 70% of women have been screened using a high-performance test by the age of 35 and again by the age of 45. 90% of women identified with cervical disease are treated. Achieving these targets will save lives and contribute to the Sustainable Development Goal 3.4 on reducing premature deaths from non-communicable diseases by a third. It is of note that India is advancing the inclusion of HPV vaccination in the Universal Immunization Program to protect millions of women and girls against the risk of cervical cancer. India's COVID response has demonstrated that the country can deploy and achieve rapid scale-up of cost-effective screening services across states and union territories. Universal screening for cervical cancer at similar scale and integrating services that support its elimination with all aspects of health services, including sexual, reproductive, and family planning, immunization, adolescent health services, and cancer control are critical to achieve elimination goals. Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, Ayushman Bharat Health and Wellness Centers, and population-based NCD screenings also have a vital role in elimination process, as does multisectoral collaboration to harness new technologies for early detection and management of cervical cancers. WHO will continue to support India in strengthening country capacity and expanding cervical cancer screening, prevention, control, and management services for achieving the cervical cancer elimination goals by 2030. No one must be left behind. We have the tools. All of us must regard each day as a day of action to accelerate progress towards achieving cervical cancer elimination. Thank you.